Hello everyone. So welcome back. And today I'm going to ask you a simple question. Do you think this is good? Is this good? Is this going to give a good message to the society? Is this going to guide the youth? I don't think so. Seriously, I don't think so. Soraya, the girl who is in 28, 20s, like 28 years or something, and she chosen to die through the euthanasia, through the legal way, which is she's saying that she's having mental issues like depression, anxiety from the childhood, and she don't want to live anymore, and she chosen this legal way to approach to this. Do you think this is going to give a good image, good guide or message to society, to the younger one? It's not doesn't matter the younger or older, to the society. Do you think it's going to give a good message to society? I don't think so. I'm not going to support this kind of things. Before that, I want to tell you that depression or any mental illness is not like whatever you're seeing through the movies. It doesn't like the people who was in a relationship and suddenly got breakup and was drinking and taking cigarette and depressive like that. He's growing up his hair, and this is just a show off. Okay, you need to understand that. And those who thinking like feeling low in a day, they feel like, oh, I'm depressed. No, that is just a mood things. There is lot of misunderstanding, lot of misguidance was there through this media, social media, movies, and all things. So you need to understand that depression is not simple thing. It's a it should give proper care. It should have proper way to approach to such people, because it's very important. This girl who is living with his boyfriend and having cats and all, and why she's choosing to get euthanasia. There's a question that sparked the world. People around the world, like in a two-way now. Like those who supporting, those who against it. Everything like that. For everything in this world, they should have opinion from different people, different opinion, and people will support this, people will support that. That's a normal. That's it. That's about society. That's about the human being. So I'm not against that. Those who supporting the girl, those who against the girl, it doesn't matter. But the thing is, you need to understand, depression is not simple. And one more thing I want to tell you, that in India, there's a very famous case was there about Aruna, the nurse who was sexually assaulted, and got vegetative for more than 41 years. After that, she got granted for this euthanasia. That was, I really feel like that is like a what to say. It's like humanity from the judicial side. That's what I feel about that case. It was really brutal. If you if you have time, you can go through that case. And in such a case, you can do it, okay, for helping them and all. But in mental issues, in depression, delusions, hallucinations, the mental illness is not just depression. I used to work in Bangalore Nimhans, not in psychiatry directly, but in neurology. But I used to have a having exposure to the psychiatry part. So there, the depressive part I have seen all kind of cases in different ways over there, who's having see, depression or the mental illness, it's a what to say, it needs proper care. It just not about the medicine, it's about the mental support. It's about a lot of other caring and all things that we need it for such people. So those who out there who's having this kind of issues, you can talk to me. I really like to help you. I still remember that I used to work in online. There was uh, one patient came up and who talked about her depressive period and her experience. I feel so sad about that, because real depressed guys or real depressed diagnosis is made by certain criteria, and we should follow for certain weeks, certain time period. And those who I don't want to tell about that case, so I uh, just want to slip over. Okay, that's it. So listen, leave it. So I want to tell you this thing, that those who out there who are depressive, who are having mental illness, who are having any kind of mental related issues, you need to understand that you are not alone. Almost about 60 to 80 percentage of people in this world having the same problem. You don't need to focus on that. You need to focus on your career, your thing. So go on that thing. That's it. That's all about life. Okay, that's all about you need to do in your life too. Everyone is the life is like a drama and you are the artist over there, so you have to play well, right? That's it. That's all about life I want to tell you. And those who having some mental issues, who are not strong or something, I want to tell you that please go out, take up your bag, pack your things, just go, just travel somewhere. It doesn't matter you go abroad or not. You can travel in nearby places, see people, their life, their things and all. I'll tell you one more thing, that I used to have a lot of problems, health issues, and I have depressive moments in my life too, especially in a COVID time. I used to be isolated for more than 40 plus 60 days, something like that, in a room. So it's all about, how you go through all this thing. And after that, after COVID, I chose to work in Kashi. Kashi means Varanasi. There was I worked in a cancer hospital. There I saw, actually that gave me the new life, new, what to say, new energy, or new light to my life, I can say in that way. Because in the cancer hospital, that's the best cancer hospital, you must know that the Tata Cancer Hospital is one of the best in the world. That's in the India, I'm not saying the world, okay, that's in the India. You can search it out and you can understand it out. Many people are taking medical care from the Tata hospital, because it's giving you the best and advanced technology and the best treatment and care and all. So in that hospital I saw many people who having real issues in the real life, from age 5, maybe 2, maybe from the age 2 to 80 plus. So that changed me a lot. That changed my way of looking into life. That gave me an immense strength to my life. I used to have depressive moments. I used to have people saying that you're clueless, you're, what to say, you're not that efficient on work or something. Then I feel like, oh, something like that. Then I used to think about that moment in my life. There, I used to see. I should think about that, then I get my energy back. That's all about the travel and all. And those who out there who's really want some help, you can talk to me. I'm not joking. You can just comment over or you can contact me in any way. I can help you. So talking to other people will definitely going to help you in such a way. So our topic is about euthanasia. Then we come to the depression, right? Psychiatric illness is some way, it's like a so much of misconception, misunderstood be in the air. If I tell you the PTSD, post-traumatic stress disorder, it is something which is not like one who having a problem after an accident or an event, not like that. It can happen anytime to anyone. It's about the life event, just not about some natural disaster or accident or no. Even if it is happen after sexual assault, even if it is happening after a traumatic, what to say, even in exams, if you're having a bad exam scores, in children they have this thing, they have fear of writing exam again. Heard about this thing in a real life, okay. Then come to other thing that I want to tell you, that there's so much of other disorder which been in air, having so much of misunderstanding. Anxiety, especially anxiety is, there's so much of anxieties are there, and it's entirely different from panic attack. Those who having an exam and on the day before the exam, you at the night you feel like breathless and you taking up, you having a palpitation, you are sweating a lot, that doesn't mean that you're having a heart attack or you're having a PTSD or you're having any other issue. Just this it is got a panic attack, it because of your stress and anxiety, right? So a lot of things in the air which is having a lot of misconception. So avoid social media for watching such a things, because it's not going to give you the right information. One more thing I want to tell you, that psychology and psychiatry, there's a huge difference between psychiatry and psychologist. So for those who having any kind of this kind of issues, you should talk to psychiatry first, and then they will advise what to do. In some cases you don't need to go to psychologist, because difference between psychology and psychiatry is one who going to give you the diagnosis. See, I'll give you an example. you having how the psychologists can't differentiate between PTSD, panic attack, anxiety, and this thing. Only thing they can do, they can counsel, they can ask your past, they can ask your present events, your life story, and then they can give you an what to say, some sort of management to this thing. Okay, so those who out there who's having this kind of issue don't need to go to consult a counselor first. You need to see a psychiatrist first, and then they will decide it what kind of problem you're having, what kind of things you're having, and they will decide where to go. And in most of the case, you don't need to see a psychologist. Okay, that's you should understand. And last one, I want to tell you that about the depression and suicide and events. To all out everyone up there, you need to understand few things in life. I know it's hard to digest from people's words to the reality, because I know that I used to hear a lot of stories. I know that how the suicide works, how the depression works in real life. So, such a people, I'm telling you that one simple thing, it's very easy to give up in your life, but it's not that easy to live. To live a life to success, it needs a lot of courage, it needs a lot of energy, it is a lot of hard work and everything. And to give up is very much an easy stuff, and I don't think so. We need to do this in this world. So, out there, to everyone, whoever having this kind of thoughts and this kind of things, understand that it's a very easy thing. So don't do that. It's a time that we can prove yourself that you can do a lot of things, and you can help so many, and do many things. And that's all I want to tell you. And for any help, you can contact me. So that's it. That's all about today. And the euthanasia part is the personal choice. Basically, I have no right to interfere into such a thing. But for the psychiatric illness, if they choose euthanasia, then it's going to be really bad, because everyone must have gone through something in some way. So you cannot always go for this euthanasia and all. And what about this other deceased? So it's a time that the government should alert to take decision in such a way. At least they could give a time period of at least 6 months or 1 year, that give proper treatment and all. If still she don't want to live, proceed to euthanasia. That is her choice. But giving a one more chance is going to give a hope to it's going to give some guidance to the people, to the next generation, and the other people on this going through the same way. This is all I want to tell you today. So be happy, all be happy, and do something big in life. It's all about life. Okay, thank you.